St. Theresa Point, a remote First Nations community in northern Manitoba, was hit hard by the first wave of H1N1 in the spring. Mass immunization planning began shortly after the crisis in May, and soon a call for volunteers.
Chief and Council were absolutely in support of as many volunteers as possible. There was to be a radio program calling for volunteers with specific skill sets.
The call was answered from far and wide. Elaine McDougall is a nurse working for Health Canada in southern Manitoba. This isn't the first time she's volunteered to help out this community.
I was actually in St. Theresa when the first wave hit. I was up there helping out in the community, in the nursing station. So I knew how important this is for all the First Nation communities.
Elaine is one of 14 volunteer team members led by Joe Gesheru, the nurse manager at St. Theresa Point, who has been working with the team for close to 6 months.
We have had several meetings to train them and prepare them for the mass immunization. I'm energized by the support that we are receiving.
Bags are packed and spirits are surprisingly high as the volunteers get ready to board the small plane bound for this isolated community. Lending a helping hand to those in need seems to be what drives these Health Canada employee volunteers, many leaving young families behind.
I have a 7-year-old and a 23-month-old, so it's a little bit difficult to leave them, but because they know where I am, they know I'll be safe, they know that I have a good team that I'm going up with, they're very supportive, and I'll be home soon, so.
The effects of the first wave on the community seems to have heightened awareness. People aren't taking any chances here as young and old make their way to the vaccination clinic at the brand new nursing station.
This $7 million nursing station recently opened its doors to accommodate the ever-increasing population here at St. Theresa Point. And the timing couldn't be better, as hundreds make their way through the doors of this nursing station for day one of the H1N1 immunization clinic. And if all goes well, 4,000 needles will go into the arms of all eligible in the community.
They have really focused on doing education, and education for all of the public and the community as a whole. So I think that's really been instrumental to getting, folks aware that we're here and to come down and to be immunized.
Ask people in this community why it's so important to get the H1N1 flu shot, and the answer is simply put in both languages, Cree and English.
So you won't get sick. That's it.
One of my nieces was really ill in the springtime. She was hospitalized, had to be hooked up to a ventilator. So I don't want anybody to go through that.
I was speaking with one grandmother, and she had, I think she said, a 2-month-old child, baby, that was in hospital in Winnipeg with the H1N1 and on a ventilator. And so, yeah, the baby was quite ill. To see all of the devastating effects that it had on the people. And yeah, it was no question for me or my family.
The team flown in from other parts of the country handled the crowd with ease. And that's thanks to another army of more volunteers from the community itself. Day one of this clinic comes off without a hitch. And so far, as the second wave makes its way across the country, St. Theresa Point remains disease-free. The day winds down, and everyone takes solace in knowing that with a little help given to those in need, much can be achieved. All it takes is a helping hand.
The old cliche is that to raise a child, you need to have the community, and that's exactly what we like to promote in our community. Trevor?